And the latest and greatest procedure hitting Beverly Hills right now, it's the talk of the town. It's the vampire facelift.
It is the hottest new beauty trend in Hollywood, the vampire facelift.
Cosmetic medicine specialist performs a new procedure nicknamed the vampire facelift, using your own blood to make your face look years younger.
This was called the vampire facelift.
It's called the vampire facelift because it uses your own blood to fill wrinkles. It lasts a good long time.
Now a handful of Austin doctors are riding the vampire facelift wave.
We've got a new wrinkle buster, and this was something that was presented at our big meeting back in October, the American Society of Plastic Surgeons.
One of the latest procedures, the so-called vampire facelift.
What is this, a purse?
What is the red one thing?
Oh, this red glitter is fabulous. It's from Dr. Nassif of Beverly Hills. It's the vampire facelift. This is the latest, greatest thing to hit Beverly Hills.
Oh, I gotta see what that
Well, it's called the vampire facelift. Why? It's proving to keep many looking younger.
There is a procedure that can make you look years younger without the use of artificial fillers. It uses a patient's own blood. Alita Lopez has more on vampire facelifts.
Dr. Reynolds saw beyond that and coined the designer procedure known as the vampire facelift. One of the world-leading plastic surgeons, Dr. Diamonds, is seeing a major boost in interest as soon as the photo of Kim tweeted out.
This week we have a lot of the procedures lined up, yes. Plasma is very safe. It's your own blood being injected back in, basically, so it's 100% safe.
I think that initially people thought that it was kind of a gimmicky, sexy kind of procedure, but now it's caught on and really caught fire.
The vampire.
Vampire.
The vampire.
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 Vampire. Vampire face.
The latest anti-aging efforts don't involve surgery or extensive downtime. New youthful options for women are available that use only a shot to bring feelings of heightened well-being and reviving the feelings of intimacy. I'm talking about the O-Shot, and joining me to discuss this approach is the inventor, Dr. Charles Runnels, along with Brenda Skaggs, a nurse with the Artemis Medical Group that offers the O-Shot here in Columbus. Welcome to both of you.
Thank you.
And Doctor, it's a pleasure to have you here, traveling in from, Alabama, where you're from.
Thank you.
The O-Shot is your invention.
Yes.
How would you describe it?
First of all, thank you for having the courage to talk about this.
Well, it is important, and I know there's women out there who have issues.
And it's difficult to talk about it. Even though somewhere around 40% of women have difficulty with their sexuality, only 14% of them ever have a conversation with their doctor. And so thank you for having the courage to bring it out. It's such a huge problem.
So how does the O-Shot help these folks?
Well, there are 4 major problems that women suffer with: either pain with intercourse, or trouble with arousal or sex drive, or trouble with having an orgasm. Emerson called sex and beauty the scaffolding of love. So even though a relationship can develop where it's not as important, it's so important. As an example, I had a woman who lives close to me who delivered a 10-pound baby. And in her 20s, now all of a sudden she has pain with intercourse. She has urinary incontinence. She's trying to maintain a relationship with her husband. And that, it makes her feel unlovable and started to interfere with her marriage, just as one example. And within a month of having this shot, she's back to having comfortable relations with her husband again.
This just isn't a regular shot, though. This is a shot involving part of the person themselves, which is a little difficult for some people to understand how that works.
Yes. Thank you for bringing that up, because there is no foreign body injected. There's no surgery. It's just an injection. But I didn't invent the technology. This has been used for many years by the NFL. They'll draw blood from an athlete and inject it into the knee to help rejuvenate the knee. Basically, the way to think about it, we're creating that yellow goo. Remember when you scuffed your knee as a child and there's a scab there and there's this yellow goo there? That yellow goo is what caused the skin to regrow. And there's a way to make that in about 10 minutes minutes by drawing your blood and activating it with a little calcium. Now the blood thinks you have an injury. Wherever you put that, it rejuvenates the tissue. For at least the past 10 years, oral surgeons have used it, orthopedic surgeons have used it.
So while it's not new in this regard for women, that's what's new.
The new idea was, actually, I invented a way of regenerating the face called the vampire facelift. And the way the whole shot came about was I was treating a woman who loved it so much, she asked me, would you put this in my vagina, because I've delivered 3 children, to see if it makes things feel better. And when I did, so a woman helped think of it, and when I did, the results were so astounding, I started inviting women who I knew that had difficulties to try the procedure, and the results just continued so much. Now we have over 100 doctors doing it, and one of the lead injectors and educators are here in Columbus at the Artemis Center, where they're helping us gather research. We're ready to publish some research about it, demonstrating over 90% efficacy, and urinary incontinence as well, because that whole tissue, the tissue between the vagina and the urethra is only 1/4 of an inch. So in an 18-year-old, and even 20-something-year-olds, about 1 in 20 of them have urinary incontinence that interferes. So this helps.
Brenda, what are the reaction of your clients?
Yeah. So far, we're having a great turnout with everybody. All our patients are very, very happy. This week, I just saw one of the patients back. It's been a year since her first injection, and she was on hormone replacement therapy at that time. She's been completely off of it and still having great results at a year.
Well, last question, doctor. I have to ask, because we're talking about a shot in sensitive areas. Is it painful?
It's not. We use a numbing cream that's very strong, and by the time it's absorbed, surprisingly, there's almost no pain. And most people have 0 pain, but at the worst, they'll have something that's similar to a regular injection.
This is very interesting. Before we go, real quick, we have a couple before and after pictures, and I just wanted to show one of them because that's the other...
The vampire facelift, yes, which actually promoted the thinking of this.
And especially around the eyes, I noticed this. And this is another thing that's available at Artemis as well, correct, Brenda? Yes. So folks can come in and ask for both. And it's a pleasure to meet you. Interesting.
I was honored to be on the show. Thank you.
Thank you. And Brenda, pleasure to meet you as well. Thanks.
Restore energy and start living your life again. It can all be possible with the help of bioidentical hormone replacement. And with me this morning is George Thompson. He's with Total Med Solutions, and he brought along with him patient Jim Reynolds, who's here to share with us his story about bioidentical hormone therapy and how it improved his life. Gentlemen, good morning to you. George, always good to see you. I want you to remind our viewers exactly why people may need bioidentical hormone replacement.
Well, sure. Once you reach age 30, your testosterone levels start to decrease, and they'll decrease anywhere from 1 to 5% a year every single year thereafter. So we treat our patients with bioidentical hormone replacement, which is a natural testosterone from the soy plant, and it gives you energy, makes you feel 10, 20, 30 years younger, more mental focus, more clarity, sleep better at night. It just changes your life for the better.
Okay, so all of that information entices so many people to pick up the phone and call you like it did Jim. So you're currently a patient with Total Med Solutions. What's your story?
I came to Total Med Solutions about 6 months ago, and was apprehensive at first.
Sure.
Didn't know exactly what to expect. But what I found in the beginning was a great organization that has a team that is just unbelievable. Dr. Ellen, so thorough, so caring, and the rest of the staff just so helpful. What I really experienced from the very get-go took about 2 to 3 weeks for it to begin, but was a new vitalization of energy. Just more energy than I had had in forever. Clarity of thinking. Total recall from conversations from 2 weeks ago to 2 years ago to 2 minutes ago to even what I had for dinner last night. And at 66, that is something that's kind of new for me at this time. As you age, these things slow down.
Yeah.
I also experienced weight loss. 40 pounds over about 4.5 months, and I wish that I could say I was very diligent and exercised and watched everything that I eat. I didn't. It just happened. The energy that your body is putting forth is being spent, the metabolism speeds up. I've just kind of continued on with what my lifestyle has began to be back 5 months ago, and it has just been phenomenal. Some of the other things that I've experienced is a whole new revitalization in practically every area. A lot of my friends have come to me and said, Jim, you know, I see a difference in you. And there is a difference. The thing that a lot of them have said is, how much does this cost? You know what, I can honestly look at them and say, you know what, it has not cost me anything. It has made me money.
Wow.
The energy, the strength, the stamina, the confidence.
I mean, this is an unbelievable testimonial, George. I can see you brought, wow, I can see why you brought Jim. And obviously his story is like so many others that seek treatment. And this is very typical, isn't it?
It is. The people that I've talked to asked me, they said, you know, the cost, Jim, what about it? And I said, you know, I've been smoking for 40 years. In the last 3 weeks, I've cut down 90%. And when you're talking about smoking 2.5 packs a day for 40 years and the cost of cigarettes today, I've more than covered the cost just on the quitting smoking. My wife has also done the same.
Wow. Wow. I mean, that is a big deal. And obviously, not only is your overall health and wellness better, but you're kicking some really bad habits. And George, final thought on this.
Yeah. Well, you know, look, the fact of the matter is, when you have a program that can make you feel like you're 20 years old again, and the way that it works is real simple. We're bringing your levels back to where you were when you were 20. So that's why you have all the energy. That's why you can eat, drink, and do the things that you used to do when you're 20 years old and recover quicker. So that's changing people's lives.
It's changing people's lives. And I know you have a very special offer for GMT viewers. If they go to totalmedsolutions.com/GMT and they fill out this quick questionnaire, they can, they're getting a discount, is
They get
right?
a $50 gift certificate.
$50 gift certificate towards changing their lives, like Jim. Really big deal. The number again is 214-987-9200. Gentlemen, thank you so much. Jim, thanks for sharing your story. And over to you, Carrie.
You have done a number of shows which have been so interesting on the HCG diet. A lot of discussion about the HCG diet. Where are you now in terms of, are you more convinced of the research? Are you more convinced it works?
I'm becoming more supportive of the HCG diet. I've seen it both in friends, in colleagues, doctors who've been on it, but I've also looked at some of the newer data that has been generated, in part because we've challenged the community to generate this information for us. And let me just give you the background real quickly. When I first did the HCG diet program, I fully intended to slam it. It was being given as droplets to a lot of folks. I was traveling the country, and I've been given this idea by many different individuals saying it had helped them lose weight. So I looked into it. I didn't see any potential way it could work. But then I learned that you could not only take HCG as a droplet, which can't possibly work, but it also could take it as an injection. And it was a very old idea, which had fallen out of favor, but because of newer ideas around how it could be used, it was now gaining credence. And here was the basic concept. When a woman gets pregnant, she immediately has this huge surge of human chorionic gonadotropin, that's HCG. Now you know why they use initials.
Right, exactly.
So the HCG surges in her body and tends to allow her to use fat stores to nourish the baby. So even if she doesn't have a lot of food, again, think 5,000 years ago, mom gets pregnant, she has a little bit of fat stored up from last summer, but she doesn't have a lot of food right now. The baby's gonna starve, and the baby without enough sugar will almost immediately develop brain damage. So women really have to maintain adequate calorie loads in their body. HCG tends to allow them to do that. So researchers began thinking, well, if that's true for pregnant women, why can't that work for average people who want to lose weight? Could we give them HCG, allow it to reduce their appetite, allow them to lose fat, but not muscle? And that's the big tip.
This is a person who's losing weight with HCG. This is someone who's doing it without HCG. Now, Dr. Emma's preliminary, but these sort of pilot findings show that women, when they lose weight with HCG, primarily lose the fat. They use the yellow, so you go to help me there. They lose the yellow parts. The muscle, the red, stays intact. So the fat disappears, the weight comes off, but you're not losing, importantly, too much of the red. That's important for you to maintain, because without that muscle, you'll yo-yo right back up again.
So the first show I did, I was sort of intrigued because I was surprised, because unknown to me, there was a doctor in the audience who refers me cases. I'm a heart surgeon. There's a cardiologist in the audience who stood up and said, I'm on the HCG diet. I've lost 50, 60 pounds. I was shocked. He told me about how he got the injections. The doctor who was helping him was on our set. I asked her some questions. I was intrigued. After the show, we were criticized for doing it because folks said, yes, you appropriately said that the droplets don't work. The pills that people were taking, they're fake. But you said that this injection could work, and everyone in the medical community has pretty much disavowed this. So the next show I did, a year later, I brought on the head of the big medical society that represents all these diet doctors. And he was understandably harsh on the diet. But at the end, we agreed that there hadn't been recent research on it. The last research was done a decade ago, and things changed, and we learned more. And now we can measure these levels of hormones in our body more effectively. So we gave them the challenge to go back together. This diet doctor using HCG and the man who ran, head of the biggest society, could we create some science here? Well, they have done that. And they found some interesting information, which we're talking about in the show, that gives me reason to believe this might be a solution for some folks. It's got to be done carefully, has to be done with the doctors reputable. We don't know enough to guarantee it's going to be effective. It's still an experiment. But this is not some crazy, wacky idea. It deserves to be studied.
And you're saying with the supervision of a doctor, through injections, not through droplets, and not supplements online.
There's no free lunch here. It's going to be an injection. It's going to be a needle in your body. You'll give it to yourself, but a doctor needs to be supervising how you learn how to do this and how much you're going to take it, because these are powerful hormones. They affect testosterone levels in the body. They affect estrogen levels in the body. That might be how it works, by the way. But whatever that was happening, when you start to fool with your hormones, you need to have professionals who are really equipped in managing this to help you. But imagine if you can go on a program for 60 days, get injections, lose 30 pounds, and then, now that you're 30 pounds later, sort of start again. It sort of reboots the system, and if you've learned how to eat smarter, maybe you won't gain it back so quickly.
You obviously had people who had side effects on the most recent show I saw. I mean, and also there was some concern you even raised, but do we know if this in any way increases your risks of cancer? I mean, how do you kind of reconcile the side effects and even the cancer question?
There are all kinds of concerns that I have about injecting any hormone into the body. And yet we know that for many conditions it's quite effective. For men who have huge bellies and have no libido, we know that big belly fat destroys the testosterone that are normally made in the testicles. So we give them testosterone. With testosterone, they get their libido back, they build muscle mass, they lose their belly fat. So when used correctly, these hormones do make sense. But you can't use them willy-nilly, and they have to be studied carefully. And too often what ends up happening is you have a little lead, a little idea that makes sense because people crave it so much, you just give it to everybody. Instead, what I think we ought to do is take something like HCG and get all the major groups working together to figure out if it works. If it doesn't work, get rid of it. Let's not fool ourselves. But if it works, imagine what that could do for the #1 cause, preventable cause of morbidity and mortality in this country, which is obesity.